Learn simply for graduates, undergraduates, and practicing OBGYN. Primary ovarian failure or premature ovarian failure, where there is no ovulation and there is a stop of production of hormones, especially the estrogen and progesterone from the ovaries in less than 40 years of age. Primary ovarian insufficiency because the problem is within the ovaries. Now, in the brain, in the hypothalamus, there is a production of gonadotropin releasing hormone GnRH. This GnRH acts on the pituitary gland to produce two hormones like gonadotropins, follicle stimulating hormone, and luteinizing hormones. These two hormones are very important. They act onto the ovary and especially on the follicle, and a cluster of granulosa cells, thecal cells, and produces the oocytes. FSH act on the granulosa cell and it's important in production of estrogen. LH, it acts on the theca cell and it produces progesterone, androstenedione, which is the precursor of testosterone. And all these hormones, estrogen, progesterone, and androstenedione, are steroids and lipid soluble hormones. Premature ovarian failure is basically follicles stop responding to gonadotropins before the age of 40. Usually no clear cause, but can be linked with chromosomal abnormality like a Turner syndrome in which one X turns into the O, sometimes mutation of the genes BRCA gene, and some syndromes like Fragile X syndrome in which it is a trinucleotide repeat and lengthening of this thing. This all premature ovarian failure, there is ovarian damage, may be due to chemotherapy, radiotherapy, or sometimes autoimmune diseases. Premature ovarian failure, the mechanism we divide into two parts. The number one part of the mechanism is no or few follicles into the ovary. So that if there is a no or a few follicle into the ovaries, it started with few and it's degenerate quickly. And the another mechanism is dysfunctional follicle. Dysfunctional follicles means that follicles, they don't have any function and they can't generate gonadotropins and they don't respond to gonadotropins. So there is a LH and FSH, both are raised but they do not release the X cells. Then they produce less estrogen, less progesterone, and less androstenedione. However, 50% of the women may sometimes have the intermittent ovarian function. So if there is a less estrogen, it will act on the pituitary gland and that it will produce more LH, more FSH, and because of more LH and FSH, again the follicle don't respond and there is a less estrogen. So it's a hypergonadotrophic hypogonadism. So less estrogen, more LH, more FSH, follicles don't respond. Now the symptoms of the premature ovarian failure is number one is absent ovulation and second is low ovarian hormones. Because of absent ovulation, infrequent periods, difficulty in conceiving and infertility. And because of low ovarian hormones, hot flushes, night sweats, vaginal dryness, dyspareunia, and it's just like a menopausal type of symptoms because estrogen is protective, cardiovascular symptom, and a bone density. So the symptoms are all together because of low estrogen. So osteoporosis because and the cardiovascular disease, and these is generally mimic menopause. So as well as sometimes there is a conceiving difficulty but intermittent ovarian function, then the spontaneous pregnancy also can be possible. Now how to diagnose the premature ovarian failure is number one, estrogen is less, so LH is more, FSH is more. Then karyotyping can be done for the chromosomal abnormalities and the genetic testing also can be done to find out the Fragile X syndrome. And for the autoimmune suspected diseases, the steroid cell antibodies STCA can be similar like adrenal cortex cells, similar to the ovarian cells, can be determined for the autoimmune diseases. Now, the treatment is very simple. As there is less estrogen, replace hormones, estrogen and progesterone. Thank you so much.